And with this current surge in coronavirus cases, Idaho hospitals are on course to go back to crisis standards of care in the near future. Under crisis standards, it's possible that non-urgent or less urgent care may not be provided in order to ensure timely response to the most severe life or death emergencies. Our Doug Petcash breaks down what our largest healthcare systems are now facing in this fifth surge of COVID.
Medical leaders from Saint Alphonsus and St. Luke's told me the chances of making the move back to crisis standards of care are good if the COVID case surge fueled by the Omicron variant continues at its current pace. Both case and hospitalization numbers are rising rapidly. This week, Idaho set records for the most COVID cases reported in a single day. 2,821 new cases on Wednesday. That beat the new single-day high set just the day before, and both were higher than the previous single-day record set way back on December 9th of 2020. So our hospitals are once again under a heavy amount of stress. Saint Alphonsus announced it will temporarily close 3 urgent care clinics on weekends because of employees being sick with COVID or isolating because of possible exposure. Leaders at both hospitals say the number of staff who are out because of COVID has risen sharply in the last 2 to 3 weeks. St. Alphonsus Chief Clinical Officer Dr. Stephen Nemerson says 3 weeks ago, 20 St. Al's employees were out because of COVID. This week, 157. St. Luke's Chief Medical Officer Dr. Jim Souza says their number went from 10 people out 3 weeks ago to 250 employees out this Thursday. Now to patient numbers. Statewide, 346 patients are hospitalized with a confirmed or suspected case of COVID-19. 93 are in the ICU. As of January 13th, there were 116 COVID-positive patients at St. Luke's medical centers. Of those 116, 93 are in isolation for COVID because they are infectious. Another 23 had a positive COVID test during their hospital stay, but are no longer in isolation because they are no longer infectious or they have a non-COVID related diagnosis. At St. Alphonsus, 85 patients are COVID positive out of a total of 442. An important note, a spokesperson for the Idaho Department of Health and Welfare says the state only counts a hospitalization as COVID if that person is there because of the virus. If they went into the hospital for something else, say a birth or a broken bone, and then tested positive, Idaho does not count that as a COVID hospitalization. Even so, Drs. Nemerson and Souza say current indications point to the likely need to reinstate crisis standards of care before long. They're preparing for the worst and hoping for the best.
There's no evidence that we're coming close to a peak, and so on that basis, we expect to be able to see increasing numbers of patients on an ongoing basis, and at some point will require movement back into crisis standards of care, most likely. Of course, God willing, we will get lucky and we'll see a peak and a plateau, but right now that's not predicted.
If you ask me to do an even over on it, I'd say the odds are more probable than not. And that's because of our learned experience so far. We know in every way there's been a spike of cases. 2 weeks later, hospitalizations. 2 weeks later, deaths.
Because of the increasing number of COVID patients and staffing issues, Dr. Nemerson says St. Al's is starting to limit some non-emergency surgeries and procedures on a selective basis. Dr. Souza says St. Luke's hasn't gotten to that point yet, but they're getting prepared. On Viewpoint, they also discuss the severity of illness for those infected with the Omicron variant compared to earlier variants. Viewpoint airs Sunday morning at 9 o'clock here on News Channel 7.